Hello, everyone. This is Dr. Khan again. Sorry, I'm having technical difficulty. I'm going to go ahead and connect with Dr. Brown again. Warm welcome to everyone. Please bear with me as all right, I see the invite, and basically I am going to go and I see the Brown's coming on. It's a very good sign right now. It's the computer is adding, and so there you have it. Hello, good evening. How are you?
Hi, how are
I am
you?
very happy to connect. Yes, I am doing very well. Thank you very much. It's a pleasure for me to connect with you. Thank you so much for coming on and sharing your expertise, your journey as you have navigated explantation yourself. So I'm going to go ahead and, having said this, I'm going to go ahead and introduce Dr. Amanda Brown. She's a torchbearer for women navigating the psychosocial impacts of breast implants. She draws from her life's work in the women's health while earning a PhD in genetics and also as an officer in the United States Public Health Service. And as a clinical psychotherapist, she owns and maintains a private psychotherapy and health coaching private practice, which is evidence-based and approaches to help women achieve their self-acceptance and overcome people-pleasing childhood trauma, grief, loss, anxiety, and difficult change. In 2018, her personal life and personal expertise aligned as she moved through the explant journey herself, recovering from the disabling pain, which she didn't realize was related to having the breast implants, and then witnessed the countless women struggling with the deeply felt yet poorly supported mental, emotional, and social aspects of breast implant removal. To it, so right now we have our guest. Please go ahead and tell us what exactly is your area of expertise as you deal and talk to women on a daily basis. And please tell us more about your educational background as far as what and how you have prepared to help the many ladies who are eventually going to be undergoing this process.
Thank you. Thank you so much for having me. I'm excited to be here with you. I've watched your Facebook Lives for a couple years now, so I'm excited to be here. So I operate from a psychotherapeutic model known as acceptance and commitment therapy. If you're using it outside of therapy in a coaching setting, it's acceptance and commitment training. It's evidence-based. It has over 1,000 clinical trials, and it's known to ease all kinds of different kinds of human suffering. And so and I've specialized in that for, well, all this time in this second career of mine as a psychotherapist. So when I was going through my explant journey and I was connecting like we do with, countless other women on these journeys, I started seeing everything through not only the eyes of a therapist, but also because of that public health background that I have. And so what I noticed was just these alarming and tremendous gaps in caring for the rest of the woman as we go through these journeys. And there's rightfully a huge focus on the surgery. It's a major surgery. But there's so much that goes on before and so much that goes on during and after that's on the inside that involves our mental well-being and our social belonging and our emotional well-being. And so I noticed this giant gap. You know, there's all this social pressure that can lead us to get breast implants. And then when it comes time to remove them, there's almost like an assumption that our concern or struggle or experience is just going to be skin deep. And I know from talking with women now, you know, I specialize in this. So in addition to those things that you read, this is now a specialty focus of mine, is working with women all along these journeys, whether they're augmentation patients or women who restored their breasts after weight loss, you know, pregnancy, nursing, or reconstruction patients who've had mastectomy. And so I work with women at any point during their journey and no matter why they got breast implants. So some women want to work with me to steady, I call it steady and ready themselves as they're going into the surgery. And some women sort of, I mean, we see this a lot where women can find out about, for example, if they're doing a BII related explant, they might find out about that and maybe focus on the physical side and put a great surgical plan together and move quickly through that and almost white knuckle or overlook, you know, some of these other aspects that we experience on these journeys. And so some women will come to me, you know, right before their surgery or after their surgery, and they're realizing that there's more inner healing that they need to do.
Got it. Now, let me go ahead and start off with you. You're the expert. You have that training, you have that insight, and you have that intellect in regards to breast implant illness. Tell us what you went through. When did you realize that breast implant illness was the problem, the culprit, and how did you navigate yourself through this process? When did you first find out that breast implant illness is real and that it was very much affecting you?
Yeah. You know, I explanted in 2018, and at that time, I didn't know anything about breast implant illness. So I had been living with a lot of health problems that I didn't think to connect to my body's ongoing experience while it was, you know, trying to keep me safe from breast implants. And none of my health providers did either. So, you know, the chronic pain, the inflammation, I had a lot of chronic infections, GI issues, but most troubling to me, besides the pain and the inflammation, which was pretty life altering for me, I also developed what was misdiagnosed as a peripheral neuropathy in my upper arms. And I had very, very extreme hormonal disruption. So I honestly just thought that I was unlucky and that I was just aging very unlike my mother and all other women in my family. I just thought that I just got the short straw. And I explanted for many reasons, but the final change catalyst for me was that I had noticed a sudden shape change. And I knew that I just must have a rupture. And so I started meeting with local explant surgeons, and some of them were telling me not to believe what I'd read on social media. And some of them were encouraging me. It was just simply time to replace. And they were telling me that, you know, I wasn't going to feel better if I explanted. And I was really confused because I hadn't told them any of my health history. I just went in there requesting an explant. So as a women's health specialist, I became concerned about what happens to women who are coming for this reason, this thing that these doctors are calling breast implant illness, and they're saying it isn't real. So I went and started looking into breast implant illness, and you know, I'd already was making my plans for explant. And when I learned about BII, you know, a lot of its symptoms are non-specific, and
Right.
that's a big struggle point for women. that actually leads to some of the psychosocial issues that I work with a lot, which is it's a diagnosis of exclusion. It has non-specific symptoms. We don't have biomarkers for it. And so that opens women up to, I say it's own breed of self-doubt, you know, and these surgeries have high social stakes for women. And so the lack of a marker, a diagnostic test, that can lead our mind to start playing games on us. And we can talk more about that. But just to finish my, you know, full circle, you know, I started looking into it. I recognized so many of those symptoms as my own. And I just decided I'm explanting this shape change, this rupture. And if I feel better, that'll be fantastic. But I wanted to guard against my hopes getting elevated and then potentially having them be dashed because I really was disabled in my upper body. So I explanted, and within 3 weeks, I started to feel I had completely forgotten that I was an energetic, you know, gregarious person that I was coming back to life. I say it felt like somebody plugged me back in. So that was my first kind of hope. Maybe I did have breast implant illness. And then more time passed, and shockingly, I completely recovered from that disability. And it was a very real, it was really impacting me professionally. It was difficult for me to do my continuing education credits. It was difficult for me to, I couldn't even lift a glass of water,
How
much
sure,
less.
how sure were you going into your surgery that you were going to benefit from the surgery?
Well, I knew I was going to benefit no matter what happened because I had done a lot of inner work on all the ways that breast implants were impacting me. So I didn't want to age with them. I didn't want to live under the surgery shadow. You know, I felt a bit fraudulent in my work as a psychotherapist helping women with self-acceptance. I felt fraudulent sitting behind these two breast implants that were causing me a lot of localized problems that I was very aware of, but I was afraid of the surgery. And so I was tolerating very cold breasts. My implants in my body were extraordinarily cold. I had severe capsular contracture that I just tolerated, and they were hypersensitive. All of my hugs were compromised. And for all of those reasons, explant for me was going to be a win. It was
Right,
absolutely
right.
going to be a win. And I always encourage women on these journeys, when you're explanting for BII, if you kind of put all your eggs in that basket, you know, you're missing out on looking at all the other ways that breast implants are impacting you. And we've learned to kind of minimize those and downplay those. A lot of women, one of the things I hear the most from the women I work with is, well, you know, I did this to myself. So who am I to complain? And
See,
that's,
if I may jump in, you
yeah,
know, unfortunately, and this is kind of echoing what you said earlier, if I have a breast cancer patient right now, or a young lady in her 20s, and she were to walk into the top 100 hospitals in the country right now, tomorrow, and she were to ask these 100 plastic surgeons, all these groups, the phenomenal centers, all of them inevitably will say, this is your right, these are safe, and absolutely go ahead and proceed with the augmentation because implants are safe devices, despite all what we know that the lymphoma, the squamous cell cancer, yes, these are very small, rare events, but certainly do exist that led to the ban of the textured implants. We know the patients with the breast implant illness. We know that these are not lifelong devices, and you see
right,
patient after patient, be it 4 years later, be it 10, 15, 20 years later. Look at the case that I just did today, grade 4 contracture, capsular, hard like a rock implant sitting on the chest on this nice lady, 49 years of age, and she was a victim of breast implant illness. And unfortunately, you have so many other problems. And this goes back to the point where I myself, as an explant specialist, you will hear two things repeatedly from the many patients, my patients, and you yourself, as you have heard. The patients almost always say they wish they had never put them in, and they wish they had explanted sooner so that they could have gotten their lives back. And also
Yes.
stressing on the point, number one, that there is no imaging diagnosis, there is no lab diagnosis. That's certainly true. But this is a diagnosis of exclusion, like you very well mentioned, that you have on a questionnaire, and that is the diagnosis, if you will, that a young lady in her 20s, 30s, or even 40s, I have had patients in their 70s, believe it or not, 79-year-old lady, she came to me and she said, I'm losing my mind. And all her friends said, well, guess what? You're 79. And she knew in her heart that this is not who she is, and that she was the victim of fatigue, brain fog, and the joint pain and soreness. And she knew she was better than that. And lo and behold, she did indeed improve in her many signs and symptoms of breast implant illness that we know truly exists. And so
Yes.
going back to your point, you knew you were only going to benefit and that you really had nothing to lose.
Yes, exactly. And you know, honestly, back in 2018, especially as someone not on social media and just finding out about BII just right before I explanted, you know, I just was kind of guarding against, is it, you know, it was a tremendous thing to learn that perhaps the decade of my health decline wasn't just bad luck, you know, wasn't just some unusual, you know, combination of how I came together as a human relative to everybody else in my family, but that it was something that was reversible. I was really guarding against that because how tremendous that felt to me. And, you know, so I moved through it. And then when I got to the other side and started having those tremendous health improvements at 3 weeks, and then by 3 months, you know, at that point, I was 100% convinced, irrespective of what you want to call it or how you want to view it. I was 100% convinced that my body was so consumed with its efforts to keep me safe. Its immune system was so overwhelmed by the foreign objects, and you know, I had very thick calcified capsules. My body was working overtime to try to keep me safe. And I think that that just kind of became its full-time job. And so being able to, you know, repair those injuries that I got in my arm during a yoga class, that was low priority for my body. And it just evolved into unfixable pain that got misdiagnosed. So I don't think
Right.
my breast implants caused that upper arm pain, but I think that my body was so involved with my breast implants and what we call BII that it couldn't do anything else. It just didn't have the bandwidth, you know? And once those got removed and my body didn't have a 24/7 battle that it was going, you know, basically losing, then I think it had the ability to heal, you know,
Mhm.
which it did, you know, and that's fantastic. So
So
I'm
this is very important what you mentioned. So the explant has to be done right. And now I, as an explant specialist, 99% of what I do is explant, removal of breast implants from the many ladies that come to me from all over the US and all over the world. And this is where the implant is removed along with the capsule plus all inflamed tissue. And that the capsule is absolutely 100% tested by the pathology department to rule out the lymphoma and the squamous cell cancer. And this was the concern that the FDA brought forth 6 weeks ago, that you have to test. You have to test for the illness that many signs symptoms, including chronic inflammation, histiocytic reaction, the cancers that we know of, lymphoma, squamous cell cancer, and you have to rule out fungus infections, which I have found in my patients, along with bacterial infections, believe it or not, that we know of 10-15% of the time that we know exist, even in those patients that don't have frank cellulitis. And it has to get tested, because if it's not tested, we won't know definitively. And so it is, as per FDA, and we clearly know from the plastic surgery literature that the lymphoma rate is way underreported, and also the squamous cell cancer, amongst many of the problems that the implants cause. Now, you can imagine someone who has the grade 4 contracture, which means distortion of the chest wall with pain at rest as a direct result of the capsule that forms around the implant that causes a distortion of the chest. You can imagine that now the patient is not going to be able to feel for the self-monthly breast exam and potentially miss what is going to be breast cancer. Some patients are reluctant to get a mammogram simply because they have a hard ball sitting on the chest and they're afraid they're going to be in pain or it's going to rupture. And this is and unfortunately, there's a compromise in the standard of care where 1 out of 8 or 9 women are going to get breast cancer, and now you have man-made devices, the breast implants, that are causing all these patients not only physical harm, but what you have clearly alluded to, psychological harm. Now, let me ask you a question, Dr. Brown.
Can I add in something really quick?
Yes.
Because it's an actual live example of the work, why I do the work that I do. So just now when you were talking about the importance of testing the capsules and sending it off to pathology and finding fungus and bacteria. So what just happened to me as you were talking about that was a tremendous wave of regret and remorse, because my explant surgeon, though that surgeon did an end block and did a perfect end block, and I have pictures for it and all that, my explant surgeon reserved judgment at the time of removal, and based on appearance determined whether or not they needed to be sent off. And so mine weren't sent off. And as time has passed and I've learned more, I just attended the Breast Implant Health Summit last weekend, and looking at that research, listening to doctors like you, that remorse and regret comes up. I'm 4 years post-explant, right? And so this is the kind of work, these are very nuanced journeys, and this is a very nuanced thing for me, but helping women be able to navigate through this kind of deeper experience that we have. I can't go back 4 years. I can't undo that decision, you know, and I just have to move forward and keep learning and understanding, you know, what the loss of that data means for me, and what do I need to be doing for myself in terms of potential ongoing health struggles that I might have.
No, very important point, Dr. Brown. The eyes grossly cannot look at a specimen and determine if it's healthy, precancerous, cancerous. The histology stains, the CD30 analysis of the capsule ultimately determines with definitive certainty if this is a lymphoma or not. I cannot grossly make a determination. This is where 100% of the time I make it a point. Even someone who has no insurance, I tell them you have to send the capsule off and pay out of pocket. And we have negotiated a rate with the pathology department if your insurance doesn't cover, because we want to put closure to the reason why you were hurting. And it is important to test. And this is what the FDA said, because no one tests. And because no one is testing, this is way underreported, and many of these cases are misdiagnosed or missed, for example. And remember, the whole purpose of the surgery, and this is the importance of the complete end block, is if someone does have breast cancer, i.e. Specifically the lymphoma, if someone does have the BIA, which is the breast implant associated anaplastic large cell lymphoma, the treatment of choice and the treatment that is cure is to remove all of the capsule, plus all that inflamed tissue. And if any fluid found, it must be all definitively removed without any of it spilling into the chest. And if the capsule is left behind, then the patient was given disservice. And let's say if a lymphoma is found later on, then the surgeon has to go back into the chest and remove all of the capsule, because if that is not done, the cancer is left behind. And this is where it is imperative that the entire capsule be sent, not only for BIALCL or squamous cell cancer, but also very importantly, we know of the many patients, and this is the take-home message from me, and then I'll ask you a question. The take-home message is the entirety of the capsule must be definitively, sincerely, religiously removed, because if the capsule is left behind, we find in the many patients where the capsule was left behind, the patients don't bounce back to our normal state of good health. And then only when the second surgery is done and the residual capsule is removed, then only do these patients benefit and recover from what is breast implant illness. So it is important for the plastic surgeon to convincingly 100% believe that all capsule must be removed, because if it is not, then the patient's not going to have a bounce back and will continue to hurt from the breast implant illness symptoms. And this is very, very important. Now, let me ask you this, Dr. Brown. What are, if you can summarize, what are some of the psychosocial concerns that show up on an explant journey? For example, someone is thinking of an explantation. What are these concerns that you as a specialist will bring forth that are important to address?
Yeah, there are so many. So, and again, highly nuanced, depends on her level of support. A lot of it depends on why she's explanting, and if it's a BII related explant, how confident is she that she has BII? If a patient is confident, if they just have that knowing that some women have, it's a different experience for them. But if they're not sure, if they're wondering, or if they're surrounded by people who are dismissive and patronizing or gaslighting them, that's a very different experience for her. A lot of it depends on, is she partnered? If she's partnered, is it with a supportive partner or an unsupportive partner? Because
That is
women will
very important. That is so important.
oh
You
yes,
nailed it, I have to say, because I see this every single day and you summarized it very well. Please keep talking. This is amazing what you're saying.
yes. So is she partnered, and is it a supportive partner or no? If she's not partnered, the kinds of psychosocial concerns she's going to experience is very different than if she's safely partnered and she knows that she's going to be accepted and loved and held irrespective of her chest's appearance, right? And
Wow.
even women who are safely partnered will tell me, I'm very worried that deep down my partner is not going to be as attracted to me. And a lot of things can happen in the area of post explant intimacy. You know, no one comes to me and says, my goal is to have t-shirt sex in the dark. That's no one's goal. They want to be able to be loving and in the moment and enjoying their loving partnership. But some women, avoidance begets avoidance. And so early on after explant, while you're waiting for things to adjust and fluff and come back and all of that, some unhelpful behaviors can take over, some shame-based behaviors, some avoidance. And these are very tender, intimate things that women are going through. And often they go through these things alone. They don't have people that they're talking to about this side of explant. You know, you can't just go talk to your neighbor down the street, you know, and these topics don't come up a lot in the groups that are focused on the surgery or BII or BII detox or, you know, all of those things. So you know, I offer a Facebook group where my goal is for us to be talking about these things much, much more. We tend to have mission drift a lot because people do want to talk about the surgical stuff because it's very anxiety producing, and that's okay. That's part of this journey too, is to support the anxiety around the surgery. So,
You know,
another,
if I may just jump in from a clinical perspective, seeing patients, I have seen patients from all walks of life, and from the healthiest of relationships to the point where I had a lady come in, and I mentioned this on my last Facebook Live. I said, "Why are you coming now? You had grade 4 contracture and you were hurting and you knew." She said, "I never liked them from day one." And I have to say this boldly but bluntly. She said, "I'm here because my husband passed away and now I can do whatever I wish." And she did not have that support. Another lady, she said, "Well, my significant other is going to financially support this and she is not on board with this." And unfortunately, even though she wants to, but there are so many outside motivating factors that unfortunately are basically compounding this whole process of explantation. There are so many patients that I've talked to that waited 2, 3, 4 years before they made a decision that they wanted to go ahead and explant. And I tell the patients, remember, in the vast majority of the patients, the implant is sitting below the muscle. And this is what is essential surgery, non-cosmetic in nature. The 4 hours, 5 hours, look, 2 weeks ago, I did a 6-hour case just to remove the whole capsule in a very nice, delicate, intricate way, such that all of the capsule was definitively removed along with all of the inflamed tissue underneath the muscle. I don't touch the breast tissue that is above the muscle or the nipple areola. That in itself is an added operation. Just to do a lift alone is a 3-4 hour process. It is a task in itself, is a different surgery. And in patients who have stage 4 contracture, for example, or a lot of inflammation where they have dilated veins, to do these two surgeries where you have one at the level of the rib and then the second one at the level of the nipple areola, to combine these two surgeries and be done in 3 hours challenges the whole aspect of the explant surgery. The whole focus needs to be to do the explant perfectly right. And I use the word perfectly right, where the 100-100-0 rule, 100% of the time, 100% of the capsule is removed with 0% of the capsule remaining behind. And that now, once the patient has healed, most of the patients will not potentially, hopefully, need a lift. Now, there are patients, so I got a question earlier today. One patient was terrified, for example, she had an incision at the bottom. Now, this is a lady, she had 550 cc implant, extremely large for her chest width. And you can imagine the previous surgeon dissected much lower and below, and so her crease was much lower now, given the fact that the much larger implant was utilized. Now I have to go in and remove what is the entirety of the capsule and implant. And I don't want to be making an incision where it will be visible, especially when you go up and down. I have to go right in the crease. And if the crease was, quote, redefined by the previous surgeon, I'm handicapped in regards to where I'm going to make the cut. And as each and every single one of my patients will attest to the fact, I always make the cut in the crease so that I can hide the incision. Now, going back to the many patients, I just want to emphasize to those patients, this is essential surgery. What does that mean? During COVID, when everything was shut down and the hospitals, the operating rooms were shut down, on 9 o'clock Monday morning, I was explanting and removing implants plus capsules when the rest of the surgeons were looking and questioning the fact, how can Khan go in and remove these implants? Because this is not required or essential surgery. The hospital very appropriately and the committee determined that this was essential. This was required for the betterment of the health. And I was not fat grafting. I was not replacing the implants. I was removing for the betterment for the health of the patient. And this is a very well-known, established aspect where implants certainly do cause the badness. And what I want to let the patients know is the goal is to do the right surgery. The worst thing that anyone can go through is they look aesthetically pleasing, but deep down within, their breast implant illness linger and continue on. And now they have to undergo a second surgery to remove the residual or the secondary capsule, which means more hurt, more surgery, and sometimes more scarring than what would be initially the surgery was done right. So
Yes.
please go ahead.
And I noticed in the chat that Megan brought up another really good point, a very important point. When we say psychosocial, what we're talking about is the mental, the emotional, and the social. And included in that are these financial concerns. And so Megan brought up that another thing that we can experience on these journeys from a psychosocial perspective is some women know that they want to remove their breast implants. Some women know that their breast implants are just strongly linked to this decline in their health, and yet they cannot pay for the surgery. And that is a very difficult position for any human to endure. To your point, if this is an essential surgery and it's treated as optional or is not paid for by our health insurance, and the woman doesn't have 5 figures to pay for it, then what she's enduring mentally and emotionally is extraordinarily unique and difficult. It's a very unnatural position for a person to need an essential surgery, but be denied it because of finances. That's just an unnatural position. And so helping women navigate the growing anxiety that they can experience around that, the anger, the resentment, the feelings of betrayal, and how do they, a lot of them will internalize an aspect of this and say, I did it to myself. And so working on self-forgiveness, and letting women know that no one does this to herself. No one signs up for breast implants hoping that it won't work out. No one signs up for breast implants hoping that it's going to end with, additional surgeries and scarring and systemic illness. No one does this to herself. But until we get to that point of being able to do that work and have these conversations and work on that mindset, some women will, really suffer silently and just tolerate or endure, and that's the financial thing is very, very difficult because
Right. No, financial is very, very hard. I have to say almost a third of my patients have to borrow care credit, and it is unfortunate and a shame for the US healthcare system, the FDA, the medical insurance companies. Shame on the FMLA people, paperwork, and everyone else that they don't support what is a real problem. Just today, there's a nice patient of mine from Utah. She took 8 weeks off. She needed that time off to recover. Now, I am very happily able to, given the fact that she had 425 cc's below the muscle. You can only imagine driving and being able to recuperate. She told me today it was the psychological part of the post-explant that she had to deal with, given the stressful job, even though it's a desk job. I got a call from a plastic surgeon who was representing the Hartford Insurance, and I'll call their names out, who refused to offer my patient FMLA paperwork and basically is willing to pay this Beverly Hills plastic surgeon, and I will mention his name at the next Facebook Live, when I called him, his internist answers. He's not even available to answer the phone call. And I said, you know what? It's a plastic surgeon to a plastic surgeon talk. And I'll tell you, he has never done an explant in his life. He does not understand the psychological component of this trauma of having to endure the physical trauma of the surgery, but also in this case, the mental trauma of having to deal with the operative look. And this is exactly what you're echoing. You mentioned this, clearly, you're putting everything together. This support, the significant other support is priceless. Look at the Facebook post from earlier this week. There are patients that have come to me where the whole family is insisting, are you crazy that you're going to go to this person who's going to remove the implants? Whereas this whole department at a major institution of the US, the top 5 hospitals of the country, where they're saying that you're good and you just need to get them replaced and you're going to just remove them. And now the patient is overriding not only the other plastic surgeon, which is in itself is a challenge, but not only that, but now the family including the significant other, who's questioning the validity or the mental soundness to proceed with an explant when we know clearly, just like you mentioned, this is a real problem. And so going back to the FDA, the health department, the administrative societies, the departments of health need to understand this is a real problem, and very soon it will get accepted. And unfortunately, but look at the textured implants, right? They've been banned. Look at the many thousands of patients who have textured implants. What were they told by the insurance companies? It's okay if you have textured implants, live happily ever after. Look, we live in the Motor City. Someone has a car problem and there is a car recall. They take care of the problem right away within a day or two. You just drive into the dealership, they fix the problem free of cost. They give you, take care of you. Over here, you have a textured implant that's been associated with lymphoma. It's banned in the United States, France, and many other countries. And they're saying, don't worry about it, live happily ever after. You don't need to remove them. And this is
that's one of the things that I was observing, and why I do the work that I do, is that confusion, that volatility, that uncertainty, that complexity, that is a recipe for disaster for anyone's mindset, right? And then to have a device inside you that's recalled, but you've got one group saying it's okay, if everything's fine, it's okay, you don't need to, and other people who are saying no, that's really not safe. To a woman, especially with these high social stakes, that's a very difficult position for her to find herself in. And you layer on top of that maybe an unsupportive partner, or maybe she's lied to her children. A lot of women get breast implants before they have children, or when their children are very young, right after they finish nursing them, or it doesn't matter, but maybe there never organically was a reason to talk to their children about having breast implants. And then it just gets awkward as they get older. And now they have to have an explant surgery. Their children are definitely going to be involved, and they have to kind of come clean. I have women talk to me about, I looked in my daughter's eyes and said, no, I don't have breast implants. And now I have to tell her I lied, and there's so many, you were talking about, not being supported in a decision to explant. The fact that reconstruction patients who opt to reconstruct with implants, and then when those don't work out for them, they want to explant, the fact that any one of them is ever forced to a psychological evaluation to assess her state of mind over choosing aesthetic flat closure, that is unacceptable. It is such a double standard that the default pathway is to reconstruct straight to implants. But then whenever those aren't working out, there's these barriers, and your psychological soundness is actually questioned just simply because you're choosing aesthetic flat closure. That is an unacceptable thing that shouldn't be happening in women's health in 2022.
very well said.
Yes.
Very well
And
said.
all of this goes back to, if we just step back for 1 second and look at this, just stepped back a little bit. I love to imagine if alien anthropologists came to Earth and they were trying to make sense of this, and they stepped back and said, wait a minute, these mounds of flesh on a female's body have taken on such symbolic meaning about her worth, desirability, her completeness as a woman. They matter so much that there are surgeries to augment, restore, and reconstruct them. I think that an alien anthropologist would be like, what? And have a really hard time trying to explain, because this goes on for millennia. This has been going on, and not breast augmentation with implants, but back in 16th century England, yes, you wanted to wear a corset. You wanted to push your breasts up because you wanted to be attractive and desired and perhaps secure a better marriage and do good for your family, right? And so this has been going on for so long. These are deeply, deeply ingrained, and I call them inherited social beliefs. So when women are moving through these journeys, they are having to defy these social constructs about breasts and what they mean to us. And when you see pictures of post-explant chests or post-explant breasts, your mind is going to naturally say, hey, that kind of looks threatening. If I have that outcome, or if that happens to me, or what if, da 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 da. So what happens is a woman's nervous system, the part that does the fight, flight, or freeze, that part of her nervous system escalates. We have reason to believe that it is already escalated in BII patients, right? Because their body is constantly in that state with those foreign objects. And our bodies don't operate in a vacuum. So when your immune system is in that state, you can have higher cortisol levels, right? We have a lot of women with BII talking about new onset anxiety, new onset panic, new onset depression, right? So if you've got that, and then she feels threatened, defying the breast rule book, as I call it, she goes into surgery not at her best. It's a lot of work on her heart, physically her heart, but also our
Mhm.
symbolic heart, right? Which is part of why I'm doing the work that I'm doing is, I believe, and I am bringing to this community a way for women to know how to steady and ready themselves before they get on that operating table. And the women that work with me know how to ground themselves. They know how to use the calming part of their nervous system. It's there for the taking. And they know how to access that so that they can get ready for surgery, show up morning of, and we know that that is so important to surgical outcomes, right? If you go
Absolutely. No,
into,
very well said.
yeah,
Beautiful, very nicely said. I mean, it is making what you're saying is so true. I, as a physician, as an MD, as a plastic surgeon, will 100% attest to, and this is for the many other patients, significant others, family members. A big part of breast implant illness is the anxiety, the emotional instability, the panic attacks, the feeling of doom, the feeling suicidal ideation. This is a
yes,
very important aspect of what is breast implant illness. The entire psychological, emotional, dysregulation, if you will. And this is where the patients literally their minds go haywire. They're not able, the brain fog, for example, right? Not able
mhm,
to think clearly, being forgetful, fatigue. All of this is the big cluster that causes the patient mental abuse, physical
yes.
abuse, obviously, of the implant. And
And
I will tell you, if you ask me, there is the physical abuse, the grade 4 contracture, for example, you mentioned. That, if you ask me, is easier to tolerate than the mental abuse, the anxiety, the emotional instability, the psychological abuse of the implants, because that is a very real inherent part of what is breast implant illness. And you
yeah,
see all these patients that present with this depression, this not being able to get out of bed, not being able to attend a birthday party of
yes,
their own kid, for example, because they slept 12 hours, now they can sleep 4 more. And this is what you very, very nicely mentioned, the overall bad effect from a mental perspective.
yes. And it needs to be said that this is different than, I nearly never use this word. I don't like it for a number of reasons, but everybody knows the term mental illness. So what we're talking about right now is different. We're talking about something that is situational. We're
Mhm.
talking about something that is specific to a medical thing, right? So as a psychotherapist, I'm trained when someone's sitting across from me, I have to always be on the lookout. Is this medical? Is this medical? And there are many times where I refer patients, you need to go get a full, complete medical evaluation. We need to get your blood work looked at. Women go through perimenopause, menopause. There's a lot of things that we need to know. Is this psychological, psychosocial suffering medical? And in the case of breast implant illness, the answer is yes, right? And of course, there can be so many other things going on, and we all bring our own unique history into it. But these things do resolve, right?
Mm-hmm.
Which is also very unusual, right? So I know I have sat across from people with treatment-resistant depression. I have sat across from people with lifelong generalized anxiety disorder. But when you have a woman who's struggling with panic, anxiety, and depression, suicidal ideation, and breast implant illness, after explant, she's not struggling with that. She may be struggling with some of the emotional aftermath as she's adjusting to her post-explant aesthetics, or working on self-forgiveness, or processing her anger, right? But those other experiences, many women celebrate that the anxiety has resolved or dramatically lessened. They don't feel those panic attacks any longer. And that sense of despair has been lifted, you know? And that's why this is so important. And that's why when I was going through my journey, I just couldn't believe that women were left on their own to navigate this stuff, you know, and that there was just this, like I say, it's a very understandable focus on the surgery, absolutely. But, you know, I want to be here to help women, you know, take care of all of themselves. There is this incredible opportunity with explant. It's such an incredible opportunity for us to really heal on the inside and reclaim our minds from all of that social learning. And I say it's an opportunity, which makes it sound a little optional, but what I've seen is that we repeat what we don't repair. So if you have inner processes that lead you to feel less than or not good enough, this happens to all humans. It's just part of being human. We compare ourselves to each other. We want to fit into our group. That's associated with safety and belonging, right? Well, we just happen to live in a time where we can compare ourselves to the world by looking at a device in our hand. And we live in a time where we will surgically alter our bodies, right? So if you don't learn to repair those inner processes that lead you to feel less than, and that then lead your problem-solving mind to try to fix it by fixing your external visage, you just you maintain that behavior. So explant only removes implants from your body. It doesn't remove the old ingrained beliefs. You may learn new beliefs, like if you know the word red and then you learn the word rojo, you don't forget red. The way that the human mind works is when you learn new things, because we literally think through language and cognition, when you learn new things, it's additive. So when a woman goes through breast implant illness and she learns breast implants do not work in my body cannot have breast implants, when she learns these things, breast implants aren't lifetime devices, whatever it is that she learns, she doesn't forget or unlearn. Breasts make women sexy. Women have breasts. Bigger breasts are better. That's what I call the breast rule book. She doesn't unlearn those things. She might not believe them, or they might not push her around as much, but they can show up in tender moments. They can show up when she's alone getting in the shower. They can show up when she's trying to go to the beach or the pool. I talked to this with many women post-explant, trying to find a bathing suit, ruffles, this and that, feeling less than. Why does that woman have implants and she looks perfectly healthy? You know, all of these things continue. And so that's the opportunity on explant, is you can learn. There are practical ways and things that you can learn. And I will be the first to say that I can't stand when therapists are very soft and about as helpful as a lamp in the room, right? You know, that, and when they say things like, just learn to love yourself, or just stop thinking that way. No, if we're going to help women learn how to respond differently to these inherited thoughts that hold so much power, because this is a highly sexually objectified body part. If we're going to help women do that work, we have to be very concrete. We have to have specific things that they can do. We have to give them exercises. We have to let them know this is what you do and how you do it and when you do it and why. And that's what I do. That's why I wrote Busting Free. It literally, you can just strap in and go through that book. It's not a book that you read by the pool. It's a book that you do, because by the end of Busting Free, you will, I named it Busting Free for many reasons. You know, one, you're busting free from having the implants, but you're busting free from that inherited thinking, right? And so by the end of Busting Free, if you work that book, if you listen to the guided audios that I made, if you do the exercises, if you invest your very best in inner healing, just like you invest in choosing the best surgeon, if you do both those things for yourself, at the end of Busting Free, you will finally know how to practice self-acceptance. It
Now,
won't be,
can I please, I'm just curious if you can give us a synopsis. What is it that now you are a unique individual. I have, because you have gone through the journey yourself. There is no one on earth who can understand this better than you, because you're trained and you yourself you have experienced this from your heart and soul.
yes,
You understand this better than me. I will never
yes,
understand what it is to have, basically the body part you're talking about, the breast, for example. And the point I'm trying to make here is it is amazing for me to see how well you dissect this. Now, if I'm someone who is interested in explanting, what is it that you write in your book, if you can summarize, that kind of gives us a guidance or that support or the hope? Sometimes patients talk to me and they say, just talking to you, and they're in their tears. They
yes,
have that hope. They have
yes,
that, believe it or not, I've heard this so many times. I can, I will sleep better tonight because I talked to you, that I have a date in my mind that I'm
yes,
going to get explanted. Like they have an answer, that they know I asked them, what is the likelihood that you have breast implant illness? And they say 110%, 100%, not 99%. And this is what you were alluding to earlier. What is it that you, as the specialist, as a healer, what is it that you can tell my prospective patient? Let's say she just found out a month ago about breast implant illness, and she has all these physical challenges, emotional challenges within her mind,
mhm,
mental challenges. She has challenges within her own family, be it the mom and dad, for example, or the significant other. What is it that you can, if you can guide us, tell me how we can make her journey better, how we
yeah.
can make her experience better, so she doesn't have to go through this guilt and she feels empowered that this is her right and this is her victory into getting this done right.
Yes. You know, I appreciate that question, and, would really love to talk with you about it more, because I have so many ideas. But one thing that needs to happen is I believe that patients need to be encouraged to be taking a holistic approach. And I don't mean that in like the trendy kind of way. I mean it in like the real sense. Holistic is whole person. So you're really caring not just for their physical experience, but you are encouraging the woman to invest in her emotional, mental, and social readiness as well. So on my website, I offer a holistic explant planning checklist. Everything I do is no strings attached, because I'm very pro-social on this, and I just want women to have these resources. So she can go to my website and she can download it. I will not funnel her into anything. I don't even have that kind of stuff set up. I just want her to get the checklist. It's going to go through, by the time she's gotten to you, she's probably done a lot of the work that's on that physical side. So I am not an MD. So I do not ever tell women what to do surgically. I don't speak to that. There are people like you that they need to talk to about that. But the surgical side, I provide a checklist of, do you understand this? Right? Because what if she hasn't gone to you? What if she's getting ready to go to somebody? So do you understand what a capsule is? Do you understand about biofilm? Do you understand about the difference between the different types of explant surgery? It's a yes, no kind of checklist, and it helps her go from this overwhelming Google overload to finite things that she can check off. I've learned this. I know to ask about this. But then it moves into, and this is the uniqueness of this resource. It moves into, okay, have you thought about all the ways that your breast implants are impacting you? Let's look at the mental side of this. Let's look about what your breasts mean to you. Have you thought about your breast related self-concept? Do you happen to be partnered with somebody who's breast obsessed? Have you guys discussed this? You know, so it walks a woman through how to emotionally prepare herself for what I call the reveal, right? If you go into the reveal and you haven't prepared yourself ahead of time, and you are prone to negative self-talk, judgmentalness, there's a part of your mind that's going to show up pretty quickly, right? But you can decide the kind of woman that you want to be. You can decide how you want to treat yourself. You can choose some guiding values like self-kindness, some gentleness, some compassion, so that when you see your post-explant breasts or chest, you can respond as the woman you most want to be, the way that you would speak to your daughter or someone you love, right? And when I have these conversations with women and with the group work that I'm going to be bringing to this community, when they have this kind of preparation, they do go in feeling like, I can't control what happens. I have taken care of what I can. I have confidence in my surgeon, and I've got a plan for how I want to show up and how I want to be. And they've thought through, who do I want to talk to about this? Who's in my inner circle? What about those awkward people that are probably going to notice, but it's really awkward to talk with them about it? Like, I, I didn't want to talk with my husband's boss about my breast implant removal. You know what I mean? But it was going to be obvious. We spend a lot of time around that person. How do you navigate that internally? If your cheeks are bright red and you're feeling self-conscious, how do you navigate that? What do you do on the inside in those moments, right? And so those are the things that I believe that women should be encouraged and, more importantly, guided through. Because remember, a lot of these patients are dealing with brain fog. A lot of these patients are dealing with emotional overwhelm. And so that's why I think it's important. We're not here to tell them what to do, but we definitely want to give them very, I say I'm a walk the walk practitioner, right? So if you sit with me, we're going to talk about what we're doing, why we're doing it, make sure you understand it, and most importantly, know how to do it in your real life, not just in the office or on the telesession. And so that's what I would say is the big opportunity. If a woman is just coming to you, being able to help her holistically prepare. And I know that that's, beyond the scope of a surgeon's practice. You guys are very busy. You have a lot of stuff that you're doing. And you're right. A lot of these women, when they get to you, they have that letting down, right? You are a safe other. You represent hope and change, right? And so that's why what I'm doing, busting free was the first part. What I want to do, what I'm going to do is I'm organizing groups that your patients, you'll be able to refer your patients to. They'll be affordably priced groups. They will be with other women, and we will get them where they need to be. And it'll be women at different parts of their journey. And I know as a psychotherapist who loves group work, that when you have rolling admission and women are at different parts of their journeys, that is something magical. It really, really helps.
No, very well said. I have to say that the women, they give me the feedback, the biggest support has been their significant others, for example, and I see the bond. And also the many other ladies that they talk to at 2 a.m, for example, and they're constantly exchanging pictures, for example, their journey, so that now just to be able to talk to someone is mental relief, and they know that the good health awaits them, and this is priceless. And this is the entire purpose of the Facebook groups that we see. There are so many, and there is no other vested interest other than to help your fellow sister so that she can get back on her feet, literally, so that she can go back and enjoy life and basically be mentally free from all of these problems, that there is a real solution. And see, this
Yes.
is there are so many patients that come. I tell them, don't listen to me. The problem here is no one is listening to the patients, right? This is breast implant illness. Everyone keeps saying breast implant illness is the myth. If you get a lot of plastic surgeons together, they're going to say, don't want to hear even the word BII, breast implant illness. This is where I tell the patients, listen to the many other patients, listen to the previous patients of the surgeon, and get a feel and get that bond where you know from your heart. Because what you mentioned earlier is very important. You have to go to your primary care doctor. There are some patients I've seen that have never seen their doc in the last 20 years. No, I tell them, go to your doc, get a whole battery of tests, and they're not that many. And you want to make sure you don't have the lupus or the Lyme disease or the rheumatoid arthritis, the diabetes or undiagnosed MS. And then once all of those are ruled out, we know with good definitive certainty that this is breast implant illness. And remember, someone asked me this, and this was a journalist, that breast implant illness is going to afflict 2%, 2.4%. I said, no, 100%. And they're like, well, this is an exact, there's no such thing as 100%. And I said, look, listen to the FDA statement. 100% of the patients are going to succumb to BI because they're not meant to be in the body forever. Some implants rupture at year 4. Some cause capsular contracture. Some cause lymphoma. Some cause squamous cells. And they are not meant to be in the body forever. Sometimes they have a silent rupture. Look at the Mentor ad that said you cannot. So these are facts. You cannot nurse, or nursing moms are not recommended to get implants. This is an exact, basically, a
I've
recommendation by the Mentor
seen it.
Corporation. And then also, now these are very disturbing. Look at the Mentor ad. If you go back from this past Sunday, 3 days ago, I posted, they said that people who have depression or mental instability, they need to overcome that phase before they get implants. They themselves mentioned this in their ad, and I want you to go ahead and see it. And so the point here is that you get the workup, you get the many other ladies, just like you mentioned, who have already gone through their journey, who are going through their journey. And look how many patients, for example, if they're explanting, let's say the following week, they come in from different parts of the US, they group together, and these are lifelong friends, not because it helps them psychologically, emotionally, kind of go and fight what is this post-op phase, and that you very well mentioned and highlight that truly there is a dire need to address that, because once you're explanted, it's not over. Sometimes another war begins in the mind that you mentioned that needs to be kind of dealt with in a very smart and a very, very
Yeah.
calculated way, which is what you highlight very clearly, that this is a pre, during, and then post explant. And I like the word that you mentioned, journey, because it is truly a journey.
It is. And, for some women, it's all they can do to save for explant. And they don't have money for additional surgeries. Or some women don't want additional surgeries on their chest or their breasts, or whatever. And so, depending on the aesthetic outcome, there is this ongoing aspect too, right? So for me, my implants were over the muscle. I'm one of those rare,
Mm.
situations. When your implants are over the muscle and you explant, that is hard. That's very hard, right? And also, just like you were talking about, the lowering of the inframammary fold at the time of implant presents a pretty big challenge to an explant surgeon, right? So I have all these strikes against me, and why was my inframammary fold lowered at the time of implant? Well, because they were trying to maximize how well I measured up to what I call the breast rule book, right? Breasts have to be horizontally aligned. breasts must be symmetrical, breasts must be. So now I have this, you know, I have two inframammary folds now. My natural one is visible again, and then that artificially surgically lowered one. So I'm
See,
not the
yeah,
only
yeah. No,
person.
I see like what you meant. And you know, your surgeon, God bless him or her, did probably the best job ever. And this is one of the questions one of the nice patients asked, and this is a very valid question. The goal here is, and if I may mention, this is important. In the vast majority of the patients, the implant is below the muscle. And if you can look, and this is
Yes.
the anatomy, you got the nipple areola complex at the top, breast
Hmm.
tissue,
Yep.
muscle, and then you got the implant and you got the ribs. The whole dissection is at, if you will, at the lower level, underneath the muscle, directly on top of the rib, which is the hardest part of the whole case. To remove the entirety of the implant capsule, plus all that inflamed tissue, plus all the capsule directly on top of the rib, which is the hardest part of the case. The entire lift surgery is above the muscle, above the breast tissue, at the level of, if you look at the roof of the house, and the entire explant surgery in the vast majority of the cases where it's below the muscle at the basement level at the very bottom. These are two separate operations. And if the previous surgeon put in large implants or above the muscle where there are more where the absence or the removal of the implant will be more noticeable because it's not hiding underneath the muscle, then you're left with this new scar. And this is a scar that your surgeon inevitably had to do in order to do the right surgery.
Hmm. Yeah. And, you know, and so it's whatever you're coming into it and whatever is important to you, you know, the journey is ongoing. And so being able to navigate that and be able to respond and take care of yourself on the inside as you're going through these things, you know, a lot of women have a very difficult time post explant finding bras for different reasons. One, there's a lot of sensitivity where there's been multiple surgeries. You know, some women have had two breast surgeries, implant, explant, but other women have had different sets. You know, some women have the mastopexy, right? And so, you know, finding bras that fit post explant breasts are different. You know, a lot of times they're like softer, harder to really push up. And so it's hard for women to find bras. Bra shopping post explant is actually often a very emotional experience for women. They are right there in the mirror. They are used to the way that they looked before. And some women are very happy, they feel very liberated, they have a homecoming type experience, and they're good with it. And not all women are having that experience. And like I said, these are very nuanced. So whether it's bra shopping, intimacy, your relationship with yourself, or just you're scrolling through social media or you're watching TV and you see images that just bring up that old wiring about less than or incomplete or not good enough. Those are the things that, you know, women deserve to be holistically prepared for and then supported as they're working through and having the resources. And that is important, I think, from the surgical perspective, because, you know, unfortunately, you know, there's shows like Botched, you know,
Mm.
and the human mind can kind of learn and grab onto these negatives, right? And so some women after explant surgery can feel that their surgeons harmed them or can feel like they were botched, you know, and maybe they didn't have the right expectations going into it, or I don't know, I can't comment on the surgeries, but some surgeons really have literally done their very best given what, you know, you and I were just talking about, like with my situation. I'm sure my surgeon was like, oh, great, you know, because that's
Mm.
very
No,
hard
no,
to
I will
deal
tell you, sometimes, my heart goes out to look, someone is, I saw a patient, she went to a non-board certified plastic surgeon who had no clue what he was doing. And again,
with.
shame on Lansing, i.e. the Department of Health, for allowing these non-board certified plastic surgeons, these are general surgeons, ENT, emergency room doctors, OBGYN, dermatologists, putting in implants. This is across the country, by the way. And now we have to deal with the problem because it was not put in right, or very large implants, 1200 cc implants, 895 cc implants I removed 6 weeks ago approximately. Now the point here is sometimes the patient may be predisposed to keloid formation no matter what, because that is what you can see other scars on the rest of the body. This is what she forms, you know, because this is how she heals. And scars are a very important part of the body's healing. Sometimes you do a gallbladder surgery and or a small bowel resection or appendectomy, and people get adhesions within the bowel and they get obstruction, for example. And this was a very benign, straightforward operation, and 10 years later, out of the blue from nowhere, the patient has a small bowel obstruction. Now, what I'm going to suggest is, Dr. Brown, I am going to request my listeners to ask any questions that they may have, so you can go ahead and answer them. And again, I have to say, I'm very impressed by your knowledge, by your expertise, by your ability to connect with the ladies. And from what I know and I see every single day of my practice, you offer priceless information, a mental support, a physical, you have an answer to the ladies where they will be able to go through this in a very peaceful, content way, where they will feel not victims, but actually free and, be liberated from this problem, so that they know that this is normal, that what they're going through is a very part of the explant process, so that they understand that there is psychological support from an expert, or you have direction that you can give to the many ladies so that they can hold hands together and walk through this very painful process, you have to say, not only physically but mentally, so that they know that there is support, and there is unconditional support, and there is that freedom from this BI symptoms, but also the freedom from the way their bodies have changed physically, if you will, for the worse. Because I tell them this is the most non-cosmetic surgery that you're going to have, right? This is where the insurances need to realize, the patient's not getting any fat grafting, they're not getting anything. If anything, they're getting volume removed from their body. And this is what they're doing in order to get their health back. They're doing this to get healthy, to think better, to eat better, to be able to run and breathe better. Now, please ask any questions so that Dr. Brown can answer. Let me go ahead and see, Dr. Brown, what advice can you give to husbands for properly supporting their partners through the explant journey? Very nice question.
Such a great question. And gosh, partners, right now there is no support for partners at all. And again, there's two different kinds, right? So we've got the partner who is just like, whatever she needs, I support her, I'm going to be there with her, that's great. And then we've got the partner who is maybe grieving, right? And maybe, because they grow up in a breast obsessed society too. Their minds learn the same thing, that women have breasts, bigger breasts are better, breasts should look a certain way, there's an idealized way. So they may have a sense of grief or loss as well. They may also be grieving her whole entire experience. And we don't, I think it's important to never put a person in a situation where they have to choose between two truths. It is okay if a partner really likes breasts to look a certain way. That's okay. That's just the way it is right now, right? And it can also be true that a partner is supportive of you being healthier and you feeling better and you getting your life back. And rather than having them choose, it's helpful to support them in both of those experiences. And so if there's a partner that's listening, or if you want to tell your partner what to say, I think it's important to say, be truthful, right? I'm here for all of it. I want to hear your full experience too. You matter too, and I'm assuming this is in a safe relationship, so be truthful. I want to hear your full experience. What does this mean to you? And just have that connection, and then it's very important. This is probably the most important part of this answer. we have to ask very specifically for what we want. That is interpersonal effectiveness 101. So if it's your birthday and you tell a person, I don't want brown socks, you've helped them know one thing not to get you, right? But if you say, you know, it's my birthday and I'm really interested in taking up some drawing, so I'd love some drawing supplies. Now you give them exactly what you want. They have something they can do for you. So doing that with your partner on this journey, and this is across the board, supportive or unsupportive, asking very specifically, telling very specifically what you want and what you don't want. So being able to say, I don't want, let's say your partner's prone to teasing. I don't want to be mocked. I don't want any playfulness. I don't want any teasing right now. Let's say that your partner is prone to withdrawing and being quiet, and that leads your mind to storying in an unhelpful way. You can say, you know what I would really like from you as I'm going through this is to check in every day. I'd like for us to talk about this every day. I don't want you to go away from me. I don't want you to be quiet. I want to connect around this. So whatever it is that you want, if you want to be held, if you want daily, and maybe you want hourly reassurance, whatever it is that you want, it gotta ask directly for it, because people just can't read your mind. And sometimes they'll think, well, I better not mention it, I better not talk about it, but then that leaves you filling in the blanks. So it's really important to ask for what you want, and let your partner know, I'm going to try something different about this, and I'm going to ask very specifically for what I want, and give them boundaries if you need to, especially if you're in an unsupportive partnership. You know, let them know what you don't want said to you. So
Sure, no, this is a good answer. For myself, I tell them, go to the Facebook pages, to my public page, for example, the Facebook lives that I've done. Look at the FDA warnings. They're not meant to be in the body. They're associated with cancer. Now, the other cancer 6 weeks ago, the squamous cell, the BII exists. Look at the way how the women are hurting. Just look at one of these, like, for example, today, the Facebook Live. And I'll tell you, it doesn't take but just one video that will convince them without a doubt that this is a real problem. Look at all those checklists. And I tell them, you, and see, the good news is when you educate, they want to know because they want to help. Because they really get frustrated when they see they've gone to doctor after doctor and they keep saying, well, you're stressed out, and she's smiling and she's meaning she's not in a stressful relationship, or she's only 33 but she's got 3 kids and that's basically driving her. No, that's not the reason for the fatigue or the joint pain or the numbness, tingling in the arms. You know, you had mentioned the peripheral neuropathy, for example. You know, and again, the many signs, symptoms. And I tell the husbands, do you want to go ahead and fill this out? And you will not barely even check 1 or 2 boxes, right? And this is where, look at all these signs, symptoms of BII. You can check for her if you want, because you will see firsthand. And sometimes they are so much relieved that they know this is going to come to an end, that we have
yes.
an answer, like we have the target, we have the problem identified. And that's, yes, I will tell them, this is where once the surgery is done right, you will see not like 20%, well over 90%, 90% of the patients seek benefit relief from the many signs symptoms of breast implant illness, and they're only happier and free from all these signs symptoms. Only in those select patients where there is a rupture of silicone and the silicone has migrated to the lymph nodes, and now it has traced to the different parts of the body, be it the spleen, liver, and the other areas. For example, you know, as we have seen in the other biopsy samples where the lungs, for example, in those situations, even when the implant is removed, the bounce back is not there. And these are the patients in their, now this is anecdotally, this is where more new research needs to be done. And if you put the 2 and 2 together, you see these are the patients who have had implants from the 80s or the 90s. And no matter what, when the perfect end block is done, you still find these patients not recovering because some of the silicone has made it to the rest of the body, and hopefully it's a matter of time before it is essentially expelled by the body, be it through the macrophages, histocytic reaction. And I will mention there is no such thing as a detoxifying agent or vitamin C that's going to eliminate silicone from the body. This is not how physiology works. There is no infrared sauna that's going to eliminate silicone, or if I eat a special diet. No, it's just a matter of time. And the best detoxification agent is the surgeon completely removing all inflamed tissue so that there is no burden left behind.
Yeah, yeah.
Now, any other questions, please? Now, Dr. Brown, please, from your experience, if there is anything else you can mention, support, we will have, your information. Any of the ladies, you can see you have an expert who truly can help and understand the illness, because Dr. Brown herself has gone through. There was a question earlier. The listener was asking, how many years did you have your implants before you realized that this was BII?
Yeah, I had implants for 12 and a half years. I had a good honeymoon with them initially. But after a couple of years, I started having the local problems. Those are often overlooked in these discussions, but equally meaningful. You can't sleep on your stomach. You can't hug people without worrying that it's going to hurt you. You can't exercise the way that you want to. You can't do chest presses, all of those things. So I had a bunch of local problems. And then, like we talked about initially, I was ignorant. I didn't know about BII. I explanted in 2018, and there wasn't a lot known about it back then. It was kind of becoming more well known. So for me, it was proof of recovery after explant that let me know that I had breast implant illness. That's what did it for me, was explanting, because like I said, I moved into explant because of the rupture, and because I've been tolerating all these other things. I just didn't know about the systemic health effects. I look back at it, and this is part of that emotional stuff that we're talking about, and this is specific to BII related explant. There is a remorse, and it's just an unusual and different remorse for women that have had BII. And it's unlike other things where you look back and you think, I just wish I hadn't done that to my body. And you're concerned about what else may be going on in your body that we just don't know about. We don't understand the pathophysiology, the longer term potential consequences or things that bothers women, so being able to just compassionately open up to that remorse when it shows up and not respond to it with judgment and beating yourself up, but or fear or panic, but just being like, yeah, this is how my life is, and that's the journey that I had, and I had those in me, and I don't have them in me any longer, and I'm going to honor everything that my body's been through, and I'm going to take care of it as best as I can in the present, so acknowledge that remorse over your past and quickly pivot to the here and now, where you can be the woman you want to be, take care of your body the way that you want to take care of it, especially given everything it's done for you. It's worked so hard. Your body just one day wakes up and you go have a surgery.
Yeah.
There it is. It's like, oh, okay, I have to heal and recover now. So it's just a good opportunity to practice gratitude for our bodies and everything that they've been put through and everything that they do for us.
Sure. Now, this is very, very important that you mentioned. Now, the other thing I like, the patients tell me this, they like the patient stories where they see, wow, the eyes are better. There was an anesthesiologist, for example, she challenged and she said, I don't buy any of what you do. And I said, don't listen to me again. Look, go to Google Images, type in before and after explant face, and you will see the pictures. These ladies have nothing to gain except for their good health and the good health of their fellow sisters. And this is where you saw the expression on this anesthesiologist's face, and this is what we're talking about, the social media phenomenon, where the ladies, it is normal, healthy, and actually what you are mentioning recommended to connect with someone so that you can go through the journey together, so that you don't have to do it alone, but with the support and the mental support that you have with your other
Mhm.
best friend that's going to be, that will guide you, and you can go through the journey together so that you can learn from her experience and then apply that such that it only enhances your quality of post-operative recovery. Now, one of the other questions, Dr. Brown, it says, I was at the Flat Ball in Chicago. I missed your talk. Can you touch on the subject of explant from reconstruction after mastectomy?
Yes. And gosh, that flat ball was incredible in Chicago. It was one of the best experiences of my life. And so at my talk, what I went through was basically chapter 1 of Busting Free. So chapter 1 of Busting Free is called Why You, Me, and Millions of Others Want Better Breasts. And it goes through and explains, and no one's ever done this before. I took this very difficult theory that's been studied and proven and all of this stuff. I took this very difficult theory of how the human mind works and translated it specifically to breasts and women. And the reason that that was so relevant and poignant in an aesthetic flat closure setting is that the human mind learns when we're very little that women have breasts. You just observe it, you just learn it. And the human mind has a hobby. It's just a hobby where it likes to see relationships bi-directionally. So if it learns women have breasts, all by its little self, it derives breasts are womanly. And then it does this over many other relationships, and it combines relationships. And we've talked about some of those, like bigger breasts are better, breasts should look a certain way. So patients who choose aesthetic flat closure, their minds hold that breasts are womanly, women have breasts. And I say that that's like the first rule, the number one rule in the breast rule book. So at the Chicago Flat Retreat, we talked about the psychological flexibility of women who choose or need to pursue aesthetic flat closure and explant to flat, that their mind is also working on that rule, that social rule. And humans care about symbolic social things like that. And so how do you take care of yourself? How do you show up to that journey with a part of your mind that holds that rule and show up on your own terms? And part of why that weekend was so magical and the ball was incredible is that those are women who have busted free. They are living their best life, right? So it doesn't mean that their mind deleted all that stuff. That's not possible for human minds to do. But despite that stuff, they're there thriving, connecting, loving, and interacting with one another on their terms, just being the women that they want to be. And their worth isn't tied up in the way that their chest appears or doesn't appear. So we also talked about, I gave them an experiential exercise. It was an eyes closed exercise that I go into that in Busting Free. There's an entire chapter on how do you reconnect with this other part of yourself. We have our physical self, our body, we have our thinking self, our mind, and then we have a part of us that is outside of those things. And it's undeniable. You can experience it. And we did an eyes closed experience so people could feel it. But it's this part of you that, just like the ears hear sounds that they don't make, there's a part of you that knows your thoughts, but it isn't making your thoughts. It knows your body sensations, but it isn't making those. And that part of you endures no matter what happens to your body. So if you lose a limb, that part of you isn't impacted. And it's so important for women on these journeys, whether you're explanting to smaller breasts or you're explanting to flat, it's so important that you feel how to reconnect with that part of you, because we lose connection to that part of us. And so when you feel that there is this part of you that endures and it's outside of that breast rule book and all of those rules, then you can move forward with your life before, during, and long after explant. And you know that there's more to you than breasts. And you know that there's more to you than how you measure up to any of society's rules. And the other thing I love about Busting Free is once you learn this stuff, it isn't just specific to these breast journeys. It liberates you from all the other rules that we have, right? And women hold ourselves to a bunch of rules. What makes a good mom? You know, how should our skin look? What about my thigh gap? What about my eyebrows? You know, all of these rules about how we ought to look and how we have to be. And so that is the amazing thing about these journeys. If you put your best into it, you can really kind of live the rest of your life. You're going to care about these things. We can't unlearn them. So you're going to care about them, but you get to react on your terms. You get to choose how you respond. And there's nothing wrong with wanting to look your best, so long as you're not doing things that violate your values, put you in tremendous debt, or place you at physical harm, right? And if you've had breast implant illness and you've removed your breast implants, or you've reconstructed with breast implants and then you've explanted to flat, going back to implants isn't an option for you. There might be a part of your mind that tries to convince you that, and a lot of women call me at that part in their journeys where they've explanted because of BII and they're really unhappy, and their mind is trying to convince them to get breast implants again, right? And that's the repeating what you don't repair. And so doing the work in Busting Free helps you when that kind of thinking shows up, or comparative thinking, or judging yourself in any way. It helps you know new ways to respond that we just aren't taught when we're younger. We just aren't taught. And we aren't taught it because it's not intuitive and it's a little harder, you know, but you can learn that. I use these skills for myself every day. I used them as I was going through my own explant journey. I continue using them, and I've taught them to countless women. So you don't have to be a psychotherapist to do them. You know, I've taught them to so many women, not just on these journeys, but for, you know, I work with women who are facing other terrifying surgeries, like you have to have this surgery or you could die. You know, I've worked with women who are recovering from, you know, childhood trauma, and we use these things so that you are literally able to live your life despite what your mind might hold, or what your heart might hold, or what beliefs you have, or what memories are there. So
No,
that's,
very well said. Now, again, beautiful words, very nicely put together, very intellectual. You know, I have learned so much from you. You know, one thing that I have to mention, it is also very important, and I hear so many patients, one after another, you know, in all of this, at the end of the day, God is there to look after you. You know, when, you know, again, each one of us is different. We have our beliefs, our religious beliefs, right? But at the end of the day, you're all beautiful in the eyes of God, right? No matter what the color, no matter what the shape, no matter what the obesity factor, no matter what the age, no matter what the, if I end up, and I've used this many times with my patients, if I end up getting melanoma here at the tip of my finger, right? The textbook answer is an amputation at the joint proximal. I will tell you, if I have to go even more so in order to live to 120 happily without a chemo and to have longevity, even missing a limb. And how many patients have I taken care of a plastic reconstructive surgeon because of the flesh-eating bacteria, the necrotizing fasciitis, or the cancer of the leg, for example? You know, at the end, now this is, I myself have seen so much badness, trauma, warfare type of disaster after disaster in the trauma bay as a general surgeon, reconstructive, and as a burn surgeon. You know,
yeah.
how many bad burns have I seen in kids, car accidents, rollovers, 80-90% of the body being burnt, and you try to justify, and you say, thank God you can see. Now, this is another coping mechanism, if you will, and you say, thank God you can run, you can walk, you can hear. Yes, and this is what I tell myself, and my other patients have told me, where I feel so blessed that, you know what, I was able to cope with it. I have the best support, and mentally I'm strong because God's with me. And this is where I will tell you, I will never know what it is like to have breast cancer. You know, even though men do get breast cancer, for example. But the point here is we all get challenged. And at the end of the day, the point here is God is with us. God is listening to us. We have that faith in God. He's there to protect us, guide us. And you have that hope in God that He's going to enhance your quality of life. And He's there for us no matter what and who we are. And we have our family, and we have the prayer that works, and the faith that we have, you know, the supreme, you know, that we have that ability to connect to that God, so that we have that peace in our mind, you know, at the end of the day. Because you know what? And this is what I said, as I get older, you know, and I've said this before, I will never be 20. I will never be 30. Look, if you look at my neck, I got the neck gels. I'm never going to get basically plastic surgery on my face. Now, don't get me wrong, I can, but I will choose not to, because I embrace who I am now. For someone as a plastic surgeon, I have never put in Botox for the same reason, because there's an age with grace. Now, this is, quote, my mentality. This is me, my freedom, my choice, my well-being, where I say I'm not going to even put fillers in. And now, look, there are so many patients that I know, that I myself have talked to, where they said, well, they had a child and she would express happiness or anger, and the child would not be able to see the forehead wrinkles. And now there is a social disconnect, because the child's not able to tell if mom is happy or angry, or what is the expression, because you truly cannot read the face. Now, this is one inherent part of me as far as my practice. I could have done this, and certainly a very well financial, you know, setup that you can have as a plastic surgeon. This is what many family medicine doctors do, for example, or nurse practitioners. But I choose not to. And the point I'm trying to make here is, yes, now again, I will never know what it is like to have a mastectomy, for example. But the point here is I have taken care of a lot of patients who have lost limbs, for example, or eyesight, or in the burn patients who cannot even lift their arm up because they have a contracture. They're so happy that they're alive, and you see the freedom in their eyes, that they're able to run again, walk again, you know. So this is again where the coping mechanism, where you rely on faith and prayer and God, that truly is a peace to the mind and heart, along with the family, along with your therapy, along with a whole series of other stories. One patient told me that she finds relief just when she listens to one of the other patients said, I lost 15 pounds post explant, and I have resolution of 70% of my symptoms. And this is just her 3 days out, for example. And so this is the relief where one knows with certainty in their mind that there is a real problem and a real solution, that hopefully is just a matter of time. Just look within our post today. There's so many patients saying, I cannot wait till another month. I cannot wait till like November, for example, 17th, for example. That may be her surgical date before she, you know, so this is that hope that we have. Please, Dr. Brown, go ahead, and if you can summarize and finish for us. You've been truly, truly so helpful in helping me understand, and I can only imagine for the patients that they have that the guidance from you, and the experience and the expertise for someone who has already gone through the explantation process, so that you can understand this. And I appreciate you sharing your personal journey with your scars, for example. That is something very personable that you share, because patients can relate to that. That is priceless. Please go ahead.
I go into it in the book too. It's not a memoir at all, but I think it's very important for And it is known, and I talk about research in my book that shows that during times of distress, women seek affiliative bonds. You know, we have fight, flight, or freeze, but we also have tend and befriend. And women, just for many, many reasons, I don't have time to go into it, but I talk about it in the book, we use tend and befriend as a distress response. And that's exactly what I see going on in social media groups. It's what, you know, is why women gather, whether it's, you know, breast reconstruction or explanting to flat, whatever that is. We want to go through these journeys with people who understand what we're experiencing. That is soothing to us, you know, and helps downregulate us. So in terms of just kind of wrapping it up, you know, there's different ways that I'm helping in this area. So, you know, one, you know, you can follow me on Instagram or Facebook. It's at Dr.Amanda Savage Brown. So I try my best to squeeze, this is complex material. This is complex stuff on a touchy topic. So I do my best to try to squeeze it into those 60-second sound bites or to fit it onto a slide. But it's there for you in a way that you can feel connected and supported no matter where you're at. You can go to my website and there's lots of free resources there. So I mentioned the holistic explant planning checklist. There's a free ebook that teaches you how to use your body, your mind-body connection to activate your calming nervous system. So that's a skill that I created. It's called using your inner brake. And each letter of the BRAKE is something else that you're doing that helps activate your calming nervous system. So that's available for you. There's a blog there that is different. It's talking about different things, and each blog that I write has concrete tips, things that you can do. So there's one on explant regret, breast implant guilt, BII related self-doubt. How do you talk to other people when you think they have BII? So there's a lot of really helpful things there. There's also Busting Free, which is the book that I wrote. It just came out very recently. You can get to that from my website. It's at Amazon. But one thing I do want women to know about is that I made a digital library to go with Busting Free. So it has 30 guided audios of me, and it has videos of me demonstrating things and some templates. And so you can listen to these guided audios, and they're soothing. They help you put yourself in that calming part of your nervous system, but they guide you through some of this information that we're talking about. There's a whole module that teaches you how to practice present moment awareness so that you can drop judgment and really look at your full experience with breast implants, or really help yourself prepare for a consult, or really help yourself after surgery. There's 2 unique resources there. They're guided body scans, and there's one for explant or explant to flat. And I borrowed those from the evidence-based, mindfulness-based stress reduction. Body scans are known to kind of help your mind remap and connect with your body. So when you have had a massive surgery to your chest doesn't hold a lot of space in your mental map. Like your mouth and your hands are huge in your mind's map of the body, but your chest isn't. And so you need to do things that help your mind come to terms with the changing landscape, and it requires no movement, and so it's safe to do immediately after surgery. So people that read Busting Free, or my clients that I work with, they know to start listening to that, you know, when you get home from surgery or the next day, and listen to it a couple times, because it helps you soothe yourself, drop judgment, and then just observe and describe how your body is after surgery, and it goes through your whole body. So there's different resources available there. And then, you know, there's some coming soon placeholders on my website, because again, I am going to be developing these groups so that we can work through this material together. I know not everybody loves to read. So I want to have more of a dynamic, interactive approach to helping women through these journeys, again, because we do seek those affiliative bonds. And I do think it's important for women on these journeys to have a safe place to go that I always say that I'm agenda free. So I'm just very pro helping a woman navigate this journey. And like, I'm not going to tell you what to do. That's between you and your surgeon. You know, that's not my place to do that, but I will help you mentally, emotionally, and socially prepare yourself before, during, or after, so that you can emerge literally stronger and more radiant than you've ever been in your life. And then you can use that for the rest of your life. So, and my website is just my name, amandasavagebrown.com. And then if you want me to write any blog articles, or if you have any requests or questions, my email is in the book. You can email me. I'm just very accessible and approachable. So it's just my name again, Amanda at amandasavagebrown.com. And I'm, you know, women reach out to me all the time, and I'm happy to get back to them, but it is best to use email because social media messengers are not a good way to communicate. So, and that's it. Thanks so much for having me, Dr. Khan.
Wonderful, wonderful. No, thank you so much. It's a blessing to have someone like you knowledgeable, share your journey, share your experience. There are a lot of women, you know, 1.8 million women explant basically got augmented in 2018 all over the world. This is a problem not only part of the US, you got South America, Europe, and this is where the entire medical society, unfortunately, plastic surgery society, is very slow to respond to what is a real problem.
Yes.
As we raise awareness, the summit that you did just recently, you know, it is these that will hopefully ultimately will bring knowledge, power to the patients, who will then empower their significant others, their families, and hopefully ultimately the FDA translates this into a mandate where the insurance companies will hopefully, and only a matter of time, the health departments will mandate what would be an ICD-10 code. So these patients who are financially hurting and basically are victims of breast implant illness, they basically have the relief. I want to go ahead and I'll end with this. Right after the FDA announced that the squamous cell cancer was now part of the breast implant illness, very surprisingly, because squamous cell cancer is supposed to be at the level of the skin, for example, not within. It's supposed to be endothelial, for example, or mesodermal origin. And then I had a chance to talk to the FDA doc herself, and she said, well, I said, are you serious? You're going after 16 squamous cell cancers that have been reported, and you got millions of patients all over the world who are hurting. How come you're missing those and you're going after this? And she said, we don't have enough data. We don't have any feedback. Now, we know 350,000 complaints were made to the FDA over the years, right? We know that. Yeah. I want, and I'm going to make a video, I want each and every single one of the ladies to go ahead and write a report or a sentence that they were harmed by breast implants and that they sought resolution of their symptoms, psychological, emotional, physical, and that they were able to find the relief in what is a man-made problem. And that, look, there are reports by the Plastic Surgery Foundation where you see the BIALCL is going to peak at 2026. We have the data, right? The manufacturers themselves highlight this in their advertisements, right, on the medical journals. Just look 3 days ago on the Facebook page, you see this. We have a defined problem. What is it and why is it? But we need to do our homework so that the Dr. Corneliuson, for example, from the FDA, Dr. Bishar's partner, for example, she is the one who is directly responsible for spearheading and bringing this forth, so that they have this physical complaints by the patients, and I will basically make I'll make a Facebook post so that you can go ahead and click and just write your one paragraph complaint so that they get direct feedback from you, because this is what they told me, so that hopefully ultimately breast implants will only be banned once again like they were in 1992, and hopefully this time a permanent ban, not only for silicone implants but also for the many patients with saline implants. So Now, having said this, thank you so much for your time and efforts. God bless you for your time and your knowledge and expertise. You know, you have this unique knowledge, and thank you so much. Thank you. Thank you.
Thank you so much.
Thanks.
Take care.
You're
Bye-bye.
welcome. Bye-bye. Good night.